Well, staying with Chennai, workers involved in the massive cleanup of the oil spill on Chennai's beaches are now vulnerable to various health hazards after we at Magicbricks Now raised the issue vehemently over and over again. A fact-finding team has raised similar concerns. The team has sought the government to continuously monitor long-term effects due to exposure of hazardous chemicals to those fishermen who were helping out without any gear. Shweta caught up with Dr. Shruti, SG, on this. Take a look.
Immediately after the oil spill, in the initial days, many of the locals and people who were part of the cleanup crew, they all reported symptoms of acute toxicity, like eye, nose, throat irritation, and also some of them had cough and chest tightness, and even some school students, they experienced some nausea, vomiting, and headache. Yeah, so these were all the acute symptoms that they reported.
Okay. Do you think overprotective gear could have helped us?
Protective gear could have definitely helped reduce these symptoms. These symptoms could not have been totally done away with, but definitely the occurrence of these symptoms would have been reduced if they had used proper protective gear.
Were the medical camps effective?
There was one medical camp, and that was also a makeshift medical camp from an Amma canteen, and it was mainly to deal with the short-term problems that were there. Probably if they had injuries, they had TT injections, and they had minimal essential medicines. And in the sense of the oil spill and the long-term follow-up that is required, that alone is not enough, and it requires a larger medical team to address the whole issue.
Okay. So what do you think about the long-term effects? How will people be affected due to this?
So in the long term, it might be several years or even decades. So people might experience, people who have been exposed to these chemicals, not for 1 or 2 days, but for a considerable period of time, without any protective gear, they might experience cancer. They might get blood cancers like leukemia, skin cancer, lung cancer, or bladder cancers. These are all proven.
So what do you think the government should be doing now?
So the government should, first of all, they should fully ascertain. They should have an expert team to to find out the scale of the spill and the disaster, and they should have a team of medical experts who can initiate a study. With what data they have on the workers, they can follow up these people, and I think they should have. But now that we have experienced this, for the future, they should have a medical team or ready with this sort of knowledge, so that they can handle these patients, and not only the government doctors, but also I think all doctors, both private and government, they have to know what problems can occur in the long term due to this oil spill, so that they can diagnose these patients better and treat them.
You can watch live TV on our website mpnow.in. Find us on Facebook at facebook.com/magicbricksnow. And don't forget to click the like button. You can also follow us on Twitter at magicbricksnow. To stay updated with all our programming, hit the subscribe button on our YouTube channel by logging on to youtube.com/magicbricksnow.